If you have topics you would like to have us discuss on the Aging Well podcast, please click on the links in the episode description to send us a text or record your message or comments. We'd love to hear from you and how we can help you age well. If you benefit from the Aging Well podcast and would like to support the content financially, please click on the Support the Show link or support our affiliates and advertisers. Welcome to the Aging Well podcast. I'm Jeff Armstrong here with Corbin Bruton. In this and the episodes that follow, we will share candid discussions on aging and hear from the experts. We are here to inform and encourage as we experience, aging. In this episode, we examine a study published in the European Heart Journal titled Body Mass Index, Weight Circumference, and Mortality in Subjects Older than 80 Years, a Mendelian randomization study. We discuss the intricate relationship between body mass index, waist circumference, and mortality among aging adults, as well as the misconceptions surrounding BMI and its limitations as a measure of health. We explore the implications of a higher BMI and its protective effect on mortality, and the paradoxical role of waist circumference as a significant risk factor for cardiovascular mortality.
Dr. Armstrong, you've had some pretty strong opinions about BMI.
I suppose I do.
There was a recent paper in the European Heart Journal titled Body Mass Index, Waist Circumference and Mortality in Subjects Older than 80 Years, a Mendelian randomization study. Man, that's a mouthful. But I was thinking diving into some fascinating research that sheds light on the relationships between body mass index, waist circumference, and mortality among aging adults sounds like a great topic for the Aging Well podcast. What do you think?
I think it's a great topic considering my feelings about BMI.
Well, before we begin, remind the listeners what BMI is and how it's calculated.
Well, BMI stands for Body Mass Index. It is a measure that is often used, inappropriately used in my humble opinion, in evaluating one's health. It is calculated as the body weight in kilograms divided by the height in meters squared.
Okay, so you say BMI is inappropriately used. Should we disregard the study from the European Heart Journal?
No, I think it is a pretty good study and provides some very important insights that can help us age well.
So before we dive into the study, what is your beef with BMI?
Well, BMI is a lousy measure of body composition. It provides us with very little information about body fat relative to lean tissue. We might as well return to the old insurance height weight charts. Remember those? You're probably too young for any of those, I assume.
I don't know what you're talking about.
Yeah, it used to be, part of how they would determine how much you had to pay for insurance was based on your height. You go on the chart, you have your height there in inches, and then you go across your body weight, and this is what you should weigh. And I think like for myself, at 6'5", I think I was supposed to weigh like 198 pounds or something like that.
That's so lean.
Yeah. And so it's basically the same thing. It's just you're manipulating the numbers in a way to give you a precise number. So you take the height divided by the weight divided by the height in meters. You're squaring your height. And it just gives you a number basically between, I don't know what the lowest might be, but, typically numbers you see will be anywhere from 18 to well above 30. And that's your BMI. So it gives the doctors and the insurance companies like a number that they can make decisions based off of. But it tells you absolutely nothing about what that number means. You can have, I can have the same BMI. My BMI doesn't really change much. But it has shifted, as I might not be lifting quite as well or something. And I maybe lose a little muscle mass and my body fat goes up. Generally, if I see an increase in my BMI at my age, it's going to be a little bit more due to increases in body fat. But if it's not changing and I'm not changing in my body fat, that doesn't tell me anything. I may be seeing sarcopenia occur, which we expect with a lot of people in aging, and so we're losing muscle mass, but we're gaining fat at the same time, we're not healthier or we're not at the same health level. We're actually worse off. So I would actually encourage older people to increase their BMI.
Right.
And that's why I was kind of excited to kind of see this article that we're going to be talking about.
Well, especially with your example, 6'5" at 190, that's like skin and bones almost.
Yeah, I've been down to that. I mean, that's about what I weighed when I was like 5% body fat, and I was way too skinny. I was under fat and probably at that point even under muscled. Wasn't horribly under muscled, but I really would have preferred and do prefer having much more muscle mass on my body.
Well, obviously, so at the end of every year, it's time to enroll for insurance through my work for the next following year, and they use a BMI index. So BMI can provide some insight, can it?
Yeah, and I don't think in the instance that you were just talking about, but considering the article that we're going to be discussing, I hate to admit it, but yes, when it is used in the right context.
Okay, so let's talk about this study and how it sheds light on the relationships between BMI, waist circumference, and mortality among aging adults. This was a prospective cohort study conducted in China. The research explored how BMI and waist circumference impacted mortality risk amongst the oldest old population. What they found was quite intriguing.
Yeah, this prospective cohort study investigated the independent and combined effects of body mass index and waist circumference on mortality among the oldest old in China. The findings revealed an inverse relationship between BMI and all-cause non-cardiovascular disease mortality, indicating that higher BMI was associated with decreased mortality risk. However, there was a positive association between higher waist circumference and increased all-cause mortality, contrasting with observational analyses. When considering joint effects, the lowest mortality risk was observed in individuals with higher BMI and lower waist circumference, suggesting a protective role of higher BMI and a detrimental effect of higher waist circumference on mortality. The study also highlighted what they called obesity paradox, where being overweight or obese was associated with decreased mortality risk in older adults, especially the oldest old. However, significant positive causal association was found between waist circumference and mortality, particularly for cardiovascular disease mortality, indicating that abdominal fat might be harmful to cardiovascular health for the oldest old population. Notably, the highest mortality risk was observed among individuals with lower BMI and higher waist circumference.
You know, it's interesting reading oldest of old when we've kind of have changed our vocabulary to that fourth age bracket. It's interesting that not everyone is on that same.
Well, not everybody's going to be on the same page with us. And again, in the research, they have to define kind of the age populations. And basically what they're saying, and this was a population that were, in excess of 80 years of age. So that makes it even more interesting when you start looking at what kind of happened in the population prior to. I mean, they've already lived to an age of 80 years or more, and what is continuing to affect their longevity, and it's that BMI and a waist circumference piece. And I think we'll dive into that a little bit deeper here as we kind of keep going forward.
Of course. The researchers also noted that higher BMI seemed to offer a protective effect on mortality among less healthy, oldest old individuals, particularly those with frailty, comorbidity, and activities of daily living disabilities. Additionally, the association between BMI and mortality was more prominent in individuals with normal cognitive compared to those with cognitive impairment.
Absolutely. And despite the prevailing notion that obesity is always detrimental to health, this study revealed some interesting or surprising findings. Higher BMI was associated with decreased mortality risk among the oldest old.
That's the obesity paradox in action. It challenges our conventional wisdom about weight and health outcomes, especially in older adults.
And it's not just BMI that's at play here. Waist circumference also plays a significant role. While higher BMI was associated with lower mortality risk, higher waist circumference was linked to increased all-cause mortality, particularly in cardiovascular mortality.
It's just a fascinating dichotomy. On one hand, we see the protective effects of a higher BMI, possibly due to better nutritional status and higher lean mass. But on the other hand, abdominal fat, as indicated by waist circumference, poses a significant risk to cardiovascular health.
And when we consider the joint effects of BMI and waist circumference, the lowest mortality risk was observed in individuals with higher BMI and lower waist circumference.
So, what does this mean for our aging adults? Should they aim for a higher BMI and a lower waist circumference?
Well, it's not quite that simple. While higher BMI may offer some protective benefits, it's essential to maintain a balance. Excessive weight gain, especially if it leads to central obesity, can increase the risk of cardiovascular disease and other adverse health outcomes.
And that's a crucial point. But isn't a major take-home message from this study that aging adults should focus on maintaining a healthy weight through a balanced diet and regular exercise? And when it comes to assessing weight and health, it's essential to consider individual factors beyond just BMI and waist circumference.
Absolutely. And factors like muscle mass, cognitive function, and overall health status all play a role in determining longevity and the quality of life.
So the paper seems to suggest that an optimal BMI might be between 24 and 28 kilograms meter squared. Would you agree?
The authors concluded, quote, there was an inverse relationship between BMI and mortality, presenting a reverse J-shaped curve with the lowest risk at around 28.0 kilogram per meter squared, end quote. I see the inflection point a bit lower, but I think it's reasonable to say that an optimal BMI might be between 24 and 26 kilograms per meter squared. I discussed my epigenetics test with True Diagnostic co-founder Hannah Wendt in episode 162. Epigenetic testing measures baseline and changes in your pace of aging, giving you the power to steer your anti-aging or health and wellness journey in the right direction. I learned that I am aging well. Click on the affiliate link in the episode description, use the promo code AGEWELL, and receive a 12% discount on your epigenetics test and monitor your pace of aging.
So you've commented in the past that you saw a similar J-curve among the COVID-19 data.
I did.
So these data are consistent with what you might expect?
They are. In fact, I felt good that these data support what I teach. It's important, however, to not forget the role of waist circumference is playing on mortality.
That's right. Visceral fat plays a role in metabolic syndrome. We talked about that in episode 147, I believe. Isn't the risk factor a waist circumference of greater than 102 centimeters or 40 inches for men and greater than 88 centimeters or 35 inches for women?
That's what I teach. What is optimal according to the study in the European Heart Journal?
It looks like maybe less than 80 centimeters or 31 inches. That seems really small.
And that's probably a factor of the population. These were old adults in China. The average waist circumference was 79.5 centimeters. I think we can safely recommend waist circumferences below the metabolic syndrome risk.
And we need to consider BMI and waist circumference.
Yeah, the combination of BMI and waist circumference may provide further insights into how body shape influences health outcomes, guiding clinical and public health practices. I'm a bit less familiar with the statistics used, but the Mendelian randomization was used to account for biases in observational studies. It revealed that higher BMI mainly decreased the risk of non-cardiovascular disease mortality, while low waist circumference mainly decreased the risk of cardiovascular disease mortality.
Let's explore this a bit further. Why might a higher BMI decrease the risk of non-cardiovascular disease mortality, while low waist circumference mainly decreases the risk of cardiovascular disease mortality?
Well, several hypotheses were proposed to explain the protective effect of BMI on mortality, including better nutritional status and higher lean mass promoting longevity. However, further external validity is necessary to confirm the causal roles of BMI and waist circumference in survival outcomes. So from this, I think we can consider what we talk about a lot on this show is that one of the important things for people to do to age well is to maintain and increase lean muscle mass. And so when we look at BMI as being just a factor of body weight, if we have a slightly higher BMI because we have more muscle mass, because we're eating well, and so having better nutritional status means that we're more well fed, which means the body systems are functioning at a bit more optimal levels. We have more lean tissue because we're active, because we have more muscle mass, we're lifting weights, whatever we're doing to maintain muscle mass, we're going to have better functionality. We're going to be able to do more activity. So all of that is going to have a better overall effect. And we talk about the things that we need to do to limit our risk of disease and to increase our longevity. Exercise on a regular basis, be physically active, eat a healthy diet, get adequate sleep, have adequate sleep hygiene, maintain a healthy body composition, and don't smoke. They don't really talk about not smoking in there, but they're focused on the factors that are contributing to that higher body mass index and a smaller waist circumference. And so if you have a smaller waist circumference, and it doesn't mean that you have to have a six-pack abs or any of that kind of stuff. It just means that relative to your hip dimensions, your waist isn't bigger than your hips. I sometimes refer to this as Dunlap's disease, where the belly Dunlap over the belt. When we have a smaller waist circumference, and so we can maintain a healthier amount of body fat as we age and maintain more muscle mass, that BMI being higher is actually an indicator of higher lean tissue. So we're looking at the people that are healthy are going to be the people who are more muscled and maybe have a moderate amount of fat to indicate that they are adequately fed and healthy in that regard. And we see, again, a J curve in here where we're going to see a slight increase in some of the mortality risks and things like that when we have a much lower BMI. Some of that is going to be from maybe a lowered nutritional status because we're not eating enough. We're maintaining a very low body fat composition. And we also see people who are much more under-muscled. And there's a lot of people, and I think that's more in the aging population, where they don't necessarily gain weight as they age. And so they're thinking they're healthy because, I weigh what I did in high school. But their muscle mass has diminished so much and their fat has increased that it doesn't change on the scale, but their health risks have changed. And then as we go upward on the scale, obviously the study is not saying that keep increasing your BMI and you're going to be healthy. So that if you're old and obese, you are healthy. That's not at all, I don't think, what the study is saying. I think we tend to see that curve jump up more in some of the mortality risks, but the mortality risks tend to increase much more when that BMI is associated with a higher waist circumference. So if I continue to work out and I'm building muscle throughout my aging process, and that increase in muscle mass starts pushing me toward obesity, according to BMI, and nobody sees my little air quotes in there, but I'm not getting unhealthy. I'm getting healthier because I have much, much more muscle mass. And so I'm going to have a lower overall risk of mortality, and my risk of heart disease is going to be lower. But if my weight starts creeping up relative to my waist circumference, I'm putting on body fat, and that's what's causing my BMI to go up. Now I'm starting to see a much greater increase in the risk of cardiovascular disease. And remember, obesity is a very central factor in metabolic syndrome, which leads to hyperinsulinemia, hypertension, high triglycerides. That leads to vascular changes. It leads to atherosclerosis, heart disease, and all the other issues that are really some of the more central factors in our medical issues that we see as we age.
Well, I also think that this could be a really good study that can help change the mindsets of a lot of those retirement homes or assisted livings or things to that nature. Because I remember when I worked in that assisted living and some of the residents were losing weight rapidly, which just kind of tends to happen. I remember the cure all was to add more calories to their meal. So we're going to add more butter. We're going to add this and that. But in reality, it's, well, let's just do some resistance training. Let's maintain the muscle mass that they actually have. Because, yeah, I remember when they would add more calories to these particular residents' meal, their weight circumference would expand out. So they're getting leaner everywhere else, but their weight, so their pants or blouses or whatever just weren't fitting as fine. And this, after reading this study and talking about, higher BMI, but a lower waist circumference, in my mind, I keep picturing those old superhero comics where the superheroes kind of had that upside down triangle look, or the women
upside down triangle or right side up. Oh, okay. Yeah. I get
yeah, upside down. So it's pointing downwards, where as it gets closer to their waist, they get more narrow, or same with the lady. So in a roundabout way, this article is saying like, hey, as you age, still maintain that superhero side of yourself, still maintain the best possible version of yourself, which is a lot of things that you preach on as well.
Absolutely. And I feel validated reading this study. I mean, when I read this study, I was like, yes, it's supporting it. Because I talk about that J shape in BMI a lot in classes anymore, especially post-COVID, as I saw in a lot of literature kept indicating that if you're in that BMI range, and I feel pretty strongly, again, I haven't done specific research in it, but evaluating the evidence that is out there, I feel very confident in making a recommendation that our BMI for best health should be somewhere between about 24 and 26 kilograms per meter squared. And in that range, especially if the range is due to increased muscle mass. So if we take into account, okay, we're more apple shaped instead of pear shaped, and that BMI should be a better indicator that we're pretty healthy. If we go below that, we start seeing more increased risk of infection and those types of things. So, with people who are below a BMI of about 22 or so had an increased risk of COVID infection, hospitalization, being on a ventilator, dying from COVID, and all that kind of stuff. And it wasn't as high as the obese category. So people that were above a BMI of 30 saw it like just skyrocketing risk of all those factors, hospitalization, death, infection, being on a ventilator, and so on. But the people that were in that healthier range had a much, much reduced risk of infection and hospitalization and all those types of things. And so I kind of compared that to Neiman's J, which doesn't have to do with body composition, but it has to do with level of physical activity. That, when you have sedentary individuals, they have an average risk of upper respiratory tract infection. You have individuals who are more moderately active, doing regular moderate exercise, have a reduced risk of infection. And those that are exercising intensely and very prolonged exercise have an increased risk of upper respiratory tract infection. So again, moderation in the exercise, moderation in body composition, all those things are going to be reflected in our BMI as well as our waist circumference. And so we don't have to be overly lean, but we want to see that body be, a little bit, like you said, an inverted triangle or V shape. We often talk about kind of going for the V shape when you're doing a lot of lifting, having a wide back, smaller waist. That all should be a pretty good indicator of overall health. Now, I don't know that you're going to see as many old with the V shape, but if we can maintain a reasonable amount of muscle mass and not have that Dunlap disease creep in, then their longevity is going to be much greater. And so, we're looking here at a population that, as you look at the oldest of old, now, of course, anybody with severe obesity and cardiovascular disease probably didn't survive to that point. But what allowed people to survive to that age and beyond is a higher level of activity, a better nutritional status, and maintaining a healthy body composition. So I can't underscore that enough, that if we want to age well, exercise, eat right, get adequate sleep hygiene, maintain a healthy body composition, and don't smoke.
Well, that's all the time that we have for today's episode. We hope that our listeners found this discussion on BMI, waist circumference, and aging insightful. Remember, aging well is about more than just the numbers that are on the scale. It's about taking care of your body, mind, and spirit as you navigate through the journey of life. Look to increase and maintain lean muscle mass, and don't allow the waist to grow as you seek to age well.
Age well.
Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.